Something to Talk About is sponsored by Fieldstone Memory Care, Bainbridge Island. Fieldstone offers innovative and compassionate care, and they are now accepting residents. So call 360-271-2530 to schedule a tour of Fieldstone's beautifully appointed apartments on Rolling Bay today. 360-271-2530. And today we are going to be talking about WA Cares. WA Cares is a state-provided insurance plan for long-term care. It's meant to help eligible adults pay for services such as home-delivered meals and dementia support. And we have Andrea Meewes Sanchez from the WA Cares Fund here to tell us a little bit about what how the program works, why this approach is being used to provide long-term coverage. And I think Cathleen Maccaul from AARP will also be joining us and will help us kind of talk through this. Thanks, Andrea, for coming. And I see you've already got the slide up.
Sure, you're welcome. Well, thank you. I really appreciate you inviting me to come talk about this. In my previous job, I actually did work at a senior center for a little bit. I was a social worker over at the West Seattle Senior Center and Central Area Senior Center. So I know just all the good work that you all do at the senior center level, and appreciate being able to be here to talk about this program from the state perspective.
Great.
Okay, so I'm the unit manager for this program. I work for the Department of Social and Health Services, and we're the agency that will eventually be administering this program. So we have a little slideshow today. We'll just talk you through all the different pieces of the puzzle, kind of how we as a state came to this program as a potential solution for Washingtonians who are facing long-term care crises. And we'll talk a little bit about how the program actually works, how it supports families. Feel free to ask a question as we go through, and there should be plenty of time at the end for questions and answers if you don't think of it while we're going through. Right, so whether or not we think about it every day, a lot of us have concerns about aging, whether it's something related to our own future or a family member or a friend. We have a few scenarios to share with you today. This is Siobhan. So she doesn't want to be a burden to her adult kids because they've got their own children to care for, but she's having trouble getting in and out of the tub and she's afraid of falling. For Barb, her mother's in her 80s and she keeps falling at home. Now she has a broken arm and she lives by herself. There's no one in town to help her. Now, these are common concerns that many of us face, either with aging parents or as we ourselves age. So many times people have had a coworker or a friend have to leave town to go help with the parent who maybe is recovering from surgery or a fall and just needed a little bit of help in their home in order to just get around. As people are living longer, dementia is becoming more prevalent, and a lot of people are living longer with multiple chronic conditions and multiple medications to take. You may have heard similar concerns to either of these two scenarios. For Naomi, she's afraid that her dad's dementia is getting worse. He put plasticware on the stove and he nearly burned down his kitchen. He doesn't want to move into a facility, and he doesn't want somebody who's not family helping him. For Ruben, his grandfather could really use medication reminders so that he could keep on top of his insulin doses before he ends up in a crisis. And he could also benefit from nutritious meal delivery to keep his blood pressure low. We worry about our parents or our grandparents or our own health as we age is something that we all need to cope with. And that need for long-term care doesn't always wait until we're older. Some people need care at younger ages. For Calvin, he's a working age person with a need for care following an accident. He spent a lot of his savings on medical care, and he's worried that he won't have enough to pay for help with everyday activities like getting ready for work so that he can lead the life that he wants. He has family in his life, but they also work, and he doesn't want to cause stress for them. He's a young man and he enjoys his independence. Long-term care can also be very expensive, and in some cases it can overwhelm a whole family's finances. In these examples, we have Hakeem. He turned 50 last year and he provided care for his mom. And at that point, he realized he wanted to purchase long-term care insurance, but it wasn't affordable to him. It would cost him $2,700 a year. And that's something he'd have to pay out of pocket, even on a fixed income in retirement, until he needed care. For Lily, she worked all of her life and retired at 70. And she had a stroke that made it really hard for her to dress, but she doesn't have the money for an assisted living facility. And she's surprised that Medicare isn't going to cover the cost. While health insurance covers medical care, a lot of people are surprised that it doesn't usually pay for long-term care. Long-term care, as we're thinking about it, is help with activities of daily living. So taking medications or bathing, eating, getting ready in the morning, getting dressed. Those are all things that are not medical care. And Medicare only covers long-term care for short periods and in limited situations. So the WA Cares Fund is a different approach to try to resolve some of these concerns for Washingtonians. With the WA Cares Fund, rather than just paying for care at the time you need it, people are paying for care by a little bit coming out of each paycheck in order to provide for care later in life. Family caregivers are often that first line of defense, the people who end up providing that first level of care to a family member. And this is Rosalind Carter. She was not only our First Lady, but also a leading advocate for caregivers. Her work is grounded in understanding the challenges that family caregivers face. Caregiving for family members isn't easy. There are lifelong established roles that often shift for people where, once we were cared for by our parents or our grandparents, and now we're caring for our parents or our grandparents. A lot of people end up leaving the workforce in order to care for a loved one, or they're trying to care for their older parent while they're also caring for their own kids at home. And that burden and stress over time can cause burnout. And just providing support, as you all know, for family caregivers can really reduce that burden so they can continue to provide care and people can continue to stay at home for as long as they want. So in addition to those stories, when you look at the population of people who are getting older, that line, that blue line, is the number of people who are 85 years and older, which will more than double between 2020 and 2034. And as people are getting older and families are less able to meet their needs, there's more need for services that will be able to support people as they need care.
So I see that is a graph that shows percent of population relative to an endpoint of 2012. So it's not, it's just showing the significant growth of 85 plus people relative to the general population, right?
That's right. Yes, good point. So right now, most of the care that is provided is usually provided by the state's Medicaid program. Right now, at least in the 2019 through 2021 biennium, it costs the state $6.4 billion to be able to provide these services. And just due to that growth in the aging population, that amount would likely double in the next couple of decades. We don't usually think about it, but these are costs that we all pay for as Washingtonians through taxes on goods and services. And just because that caseload is going to rise, there's also going to be costs that rise along with it. With an approach like the WA Cares Fund, the Washington State Medicaid savings between 2025 and 2052 could total over $1.9 billion. So it could bring significant savings for the state and also help families not have to spend down into poverty before they can access care. Without something like the WA Cares Fund, sales taxes and other taxes would have to go up to be able to meet the need. And more family caregivers might have to leave the workforce in order for them to provide that care. So why do families need a new approach to long-term care? Our current way of paying for care at the time we need it is often too expensive for families, and most people can't afford it. If you look at the data among Washington seniors, the median household income is $56,000, and half don't have a 401k or a pension income. About 7 out of 10 people who turn 65 today will need long-term care, and only about 7% of people have long-term care insurance. When you look at that annual cost of home care between 33 and 66,000, you can see that it's difficult for most families to be able to afford that that level of care for their families while they're living on a fixed income in retirement. So for a lot of people, like Diane here, it's not necessarily a question of if they will need Medicaid someday to help pay for care, but when. So for Diane, her family experienced a common and predictable path to Medicaid. There was a need for care. The family stepped in to help, but couldn't. Because her dad didn't qualify financially for Medicaid, the family paid out of pocket until they exhausted their savings. And then Diane's dad became impoverished so that he could qualify for Medicaid in order to get care. And the WA Cares Fund is a new approach to help people on alternative path. A little sip of water. So a little more about what the WA Cares Fund is. So this is a universal long-term care program, and it was enacted in 2019 by the state legislature. It's considered an earned benefit, so it works a lot like Social Security, and only people who contribute for a certain amount of time are eligible to use benefits. So it primarily serves people who are in the workforce now and earning a wage. Then they will contribute just a little bit from their wage into this WA Cares Fund. And once they're vested, they can use that to pay for care. It's entirely self-funded from worker contributions, so it reduces the need to raise taxes to pay for care. And by having affordable contributions across our careers, it's a lot more of an efficient way to pay for care than just when we need it. If you're retired, you're not paying into this fund anymore. The lifetime maximum benefit for this program is $36,500. I could pay for about 20 hours of in-home care for a full year. The contributions will start in January of 2022, and benefits will be offered for the first group of folks in January of 2025. The amount that people will pay out of their paychecks is 0.58%. So it's a little over 0.5% of your wages. So it's both a modest amount to be able to pay so that it's an affordable benefit that provides some level of meaningful coverage for people. The benefit is a flexible benefit. So that $36,500 can be used on a combination of services and supports. If you want to hire a professional home care aide to come into your home, you could do that. You could also decide to pay a family member to provide that care for you. You could make modifications to your home. You could add grab bars, for example, or a wheelchair ramp. You could also decide if you'd like to spend that money in a facility, assisted living, an adult family home, a nursing facility. That would also be another way to use those funds. A little more detail about how the program works. So if you're thinking about, what is that 0.5% of wages? What does that really look like? If you look at the typical Washington income, this is based on the median income in Washington, just $52,075 a year. The contribution for that person would be $302 a year. So it's about $24 a month. And all of those premiums go into a dedicated trust fund that can only be used for this program. It's used for people who are beneficiaries of the WA Cares Fund. There is a grandfathered period of time where people who purchased private long-term care insurance before November 1st of this year have a choice to decide whether they'd like to participate in this program. And if they do, they can use the WA Cares Fund to supplement their private long-term care insurance policy. or they can apply to permanently withdraw from the program. And the applications to withdraw from the program are accepted by the state's Employment Security Department. And that window opened up on the 1st of this month, just on Friday. And people have through December 31st of next year to apply to withdraw. One of the things that we like to share with people is that if you do have private long-term care insurance, you don't necessarily have to withdraw from this program. You could use it, say, during the elimination period, where you might have a period of time where you're eligible to use your insurance according to your functional status, but they won't pay claims. A lot of times that can be up to 90 days. With the WA Cares Fund, when someone applies, we have 45 days to determine whether or not you're eligible. And then once you're eligible, you can start using those benefits. So there could be a period of time where you would want to use the WA Cares Fund while you're waiting for your private coverage to kick in.
Yeah, I might just throw in here that I know that people have been frustrated by the application process for long-term care insurance, and sometimes there's a challenge about whether your particular situation qualifies for the insurance that you have purchased.
Yeah, that's a really great point, Reed. The pre-existing conditions or your age or your gender, those are all things that are considered by private long-term care insurance companies that the WA Cares Fund does not consider. So, doesn't matter what your health status is. If you're paying in and you earn that coverage, you're going to be able to get the care. So what do employers need to know? So employers are the ones who will be collecting those premiums, and they start doing that in January of this next year. There's only a worker portion of the payment. There's no employer portion of the payment. Only workers are contributing. Employers will report those wages and remit the employee premiums to the Employment Security Department. So it works a lot like the state's paid family and medical leave program in that way. If an employee has long-term care insurance and they don't want that additional coverage through WA Cares, then they can apply to opt out through the Employment Security Department. So all of the applications is done on an individual basis. People have to decide whether they'd like to opt out or not. And if they do, then they apply through the Employment Security Department. Employment Security Department will issue them a letter, and then they'll use that letter to show their employer that they're not included in the program. Otherwise, everyone else who's working will be automatically included in WA Cares Fund. For people who are self-employed, they can opt in to WA Cares, and that's also done through ESD. For vesting and eligibility, so I mentioned there's a minimum contribution requirement before people can start earning benefits. You have to be contributing for at least 3 years before you are eligible for benefits. And that's the second bullet here. So if you've contributed for 3 of the last 6 years from the date you apply for benefits, then you have access to that full $36,500. In order to have a permanent vesting so that you're vested for life, you have to contribute for at least 10 years without a break of 5 or more years in a row. In order for a year to count as vested, you have to work at least 500 hours during that year. That's about quarter time, so about 10 hours a week on average that you would work in a year in order for it to count as a year vested. So we get a lot of questions about this and kind of what the vesting requirements look like. So I'll give you an example for people who are starting to contribute in January of 2022. They'll contribute, say they contribute straight for 3 years. And in 2025, they have a long-term care need. So when they apply to the state will look back over the last 6 years, even though you've only been able to contribute for 3 of them. As long as you've contributed for 3 out of the last 6, then you can use your benefit. Another example that people have asked us about are people who are near retirement. So let's say instead of just having a need in 2025, you retire in 2025, then you have 3 more years of eligibility. So if you were to need care in 25, 26, or 27, then you could use that full benefit. But in 2028, if you haven't, because no one will have met that 10-year requirement, then your vesting will expire. So right now, we have an oversight body. It's our LTSS Trust Commission. They're aware of this issue, and they're looking into whether or not there could be people who contribute after retirement, or if there's a way to kind of solve that for people who are more near retirement and are concerned and hoping to be able to take advantage of this benefit. There are also some other options for folks who might retire from their full-time job, but instead decide to work part-time, or maybe they become self-employed. If you're working just on average 10 hours a week, you could become, if you're already employed, then you're going to be contributing to the fund, but you could become self-employed and you could opt in and continue those years of vesting as well. So then once you've met those contribution requirements, if you need help with at least 3 activities of daily living, we're looking at things like medication management, getting around your house, personal hygiene, bathing, dressing. If you need assistance with at least 3 of those things, and there's 10, I didn't list them all, but then you would be eligible to use your benefit. This is a cross-agency project, as I mentioned. So DSHS is the lead agency, and we'll be accepting applications in 2025 when the first group of people have contributed long enough to vest. We are also managing the provider network, so the caregiver network, people who are coming into your home to do environmental modifications, all of that. DSHS will manage those providers. The healthcare authority is going to pay the providers directly, and they will track the use of the benefit. The Employment Security Department, just like they do for our state's paid family and medical leave, will collect all of those premiums and wage reports from employers. They'll determine whether or not people have contributed long enough to be vested. They're also processing those lifetime exemptions and requests from people who are self-employed and want to opt in. And our state actuary is providing actuarial analysis to make sure that this program can stay solvent for the long term. So in summary, the WA Cares Fund is a smarter and more affordable way to support families with their long-term care needs than the current system that we have today. In the current system before WA Cares, long-term care insurance is unaffordable for a lot of people, and that's if you can even get coverage from a long-term care insurance provider. There could be fear around not being able to stay in our home as we age, and maybe our only option being a nursing home. Maybe having anxiety around the financial burden or the family burden that we're going to be placing on our families if we need long-term care someday. And then if we do need help paying for care, really our only option is to deplete those life savings and ultimately rely on Medicaid. But in the new way, with an approach like the WA Cares Fund, we're only paying for care by contributing a little bit from each paycheck. So it's affordable long-term care insurance for everyone. There's peace of mind that care is going to be available because it's provided through the state of Washington. It allows families to be able to focus on the care needs of their loved one rather than how they're going to pay for that when a care need arises, just usually in a crisis mode, not necessarily something that we're planning on receiving. And we can choose whatever mix of care that we want. So if we want a family member to provide that care, we can do that. The WA Cares Fund will even pay a spouse to be able to provide that care. So we have options to pay for long-term care and to have that care provided for us. So we do have a website we've been directing people to. We've been updating that regularly. We've got some videos up there now and some more information if you want to look at wacaresfund.wa.gov. And I'll just go ahead and open it up for questions. Does anybody have any questions or thoughts that you'd like to share?
Well, I will also introduce Kathy McCall from AARP, who has joined us as well. Kathy's been doing a lot of reporting on this, and I guess I might start with a question to her about some of the things that have come up in your reporting and things you've heard through people who are concerned about this, that might be issues that are the most prominent questions that come up.
Sure. Thanks again, Reed, for the invitation, and hello to all of the members of the Bainbridge Senior Center. I'm Kathy McCall. I'm the Advocacy Director for AARP here in Washington State. Here in Washington State, we have about 900,000 members, and you're probably wondering, why would AARP be so supportive of a program that a lot of retirees right now are not necessarily going to benefit from? And we really were focused in on this program on the WA Cares Fund because we know that long-term care is a financial burden for so many people, and that our Medicaid budget would not be able to handle it, and that there would be potentially increase in taxes, that would need to be made so property tax, sales tax, to cover off on these costs, because people have not planned and have not anticipated that they will eventually need some type of long-term care in the future. All of our data points to people are confident that they're going to retire, but they're less confident that they have the money and the savings to actually pay for it. And a lot of people don't think they're ever going to get sick and ever need long-term care. So we looked at this issue. We've been looking at it for decades. I've been working on it for about 8 years. But the biggest issue, and like I said, is that, it's around retirees and how do retirees currently benefit. We know that the near retirees is a huge issue, and we must find a solution for that. So, no piece of legislation like this ever is right the first time out of the gate. How we wish it was, but it's never. So there's always something called a trailer bill that comes along behind to fix some issues. We knew the near retirees was an issue, but we also knew that it would increase the premium being paid if we covered folks that were, let's say, 2 years away from retirement or 3 years away from retirement, and they're paying into this, but they don't get any benefits. So that's something that, as Andrea mentioned, the Long-Term Supports and Services Commission and with actuarial data is really looking at for a possible solution. And there's 2 or 3 potential ways that we could do this. So that, I think, is one of the main priorities that we're going to be looking at. The other question comes to about retirees and how many, raise a hands, who's retired already or close to it. Okay. So for retirees, it's challenging because one of the things, that Andrea mentioned is that what we're also starting to hear from members is that there are folks that want to continue to work. Maybe it's, working at your son or daughter's company, or maybe you have a side gig, doing, making cakes or pies, or you make paddleboard, wood paddles for kayaking, or you're selling earrings on Etsy, or there's a whole variety of things that a lot of times when it means retired, it doesn't mean you're stopping working. You're still doing something. I had another person I was talking to the League of Women Voters over the weekend, and she was saying, hey, I get paid for caring for my grandchildren. Does that count? And I'm like, absolutely. You probably have to file some paperwork to set up that you're self-employed. You would have to figure out the W-2, but I would think that you would qualify for that. We need to do some more checking, but being a grandparent is hard. And she said, yeah, if my daughter's paying me, she's paying me like $10 an hour, and it's more for anything just for gas and for all the snacks I'm buying my grandchildren, but it's still, she's getting paid. So that was just kind of an interesting idea because it's only 10 hours a week. And it seems like, that's something also for retirees that are saying, okay, I potentially am doing some type of work like that they could still vest. The other thing from AARP's perspective, and we've been working with DSHS, and it's written in the legislation that we must do this. We must work with the insurance industry to look for wraparound plans that potentially could augment the WA Cares Fund. But I think what could potentially happen is there might be policies that are being offered that are much lower premiums that could be affordable to individuals that might have retired and didn't have long-term care. So there's no promises. It's something that's still being looked at in terms of affordability, but it just seems to me that the insurance industry, if they're about making money, there is a huge opportunity here for them to potentially create a new product that they could sell at a much lower premium that has an equivalent monetary value in terms of a benefit once you've vested into a program or you pay through. The other thing I think that's really important to know is you are probably the best advocates for talking about the WA Cares program. We also, AARP just did some polling of our members and the general public, voters in general, is that we see it was almost 70% of people 65 and older love the WA Cares program. And we don't know exactly why, but I think what it is they realize that it is expensive and you don't anticipate, and it's hard to plan for what your life is going to be like in 30, 40, 50 years. When right now, a lot of people are in their 20s, 30s, and 40s, and they're not thinking about, what their life is going to be like 60, 70, and 80 or older. And so also the good thing is that we're all living longer because of all the healthcare advancements, but we also know, that living longer, how do you plan and anticipate for that level of care? So that's some of the things that, Reed, we're looking at and really thinking about and talking about. But I'd love to, open it up to questions. I know Andrea and I have been on a few of these calls together, and there's always some great questions that pop up. One of the other things that I would really like to encourage you, your Senator Rolfes, Christine Rolfes, incredible senator, by the way. She has done some outstanding, excellent work. We've worked really close, AARP has worked really closely with her. She is the chair of the Senate Ways and Means Committee. And I know she's hearing from a lot of her constituents, probably some of your neighbors, who are high income individuals. And that the WA Cares program doesn't make sense for them if they start penciling out and doing the back of the napkin math of the 0.58 cents for every $100. That yes, a private insurance plan is probably a better option, but that does not mean that there's something wrong with the WA Cares program. It is intended to be for middle class, middle income folks, and some higher income individuals as well, who want to pay into it and potentially have both, like Andrea was talking, having the WA Cares program and the private insurance. So anyway, I'll stop there and take any questions.
Well, I will just also ask if there is a website that AARP has. I know that Andrea mentioned a WA Cares website.
Yeah, and I can send you I'll put those links in chat. Is that okay, Reed?
That's perfect. So yes, if anybody has a question, please just open up your microphone and ask away. We'd love to, anything that's on your mind about this. I know I've certainly heard about the concern from higher income individuals that they're trying to scramble to get long-term care insurance so they can opt out. Lawrence.
Actually, Bonnie, yeah.
Well, this is not exactly a question. This is just more telling a situation. My mother had a stroke at that, this was over 20 years ago. At that time, we decided we better get long-term care after going through all of that with her. So we purchased long-term care and have been paying for over 20 years. About 2 months ago, perhaps.
Yeah, well, her premium doubled as soon as we moved up here.
Well, first our premium doubled as soon as we moved up here, but about 2 months ago, we got a letter and it said they could be raising the premiums as much as 1,300%. It was just like crazy. And so they gave you 3 options.
There was a class action suit filed against this company, Genworth, and we had some options to lower the premium and lower the coverage. So anyway, we had some options and we took one of the options.
So but the bottom line was that we thought we had this in place, and this happened, and we feel like we just got stomach punched because it is now not in place. They lowered the total amount that you could get. Now the total amount is like 17,000, and I don't know what it was before.
Yeah.
But it was just so shocking for us, and it was just, I don't know. We feel like we had worked hard to have it in place, and now what a mess. That's all, I guess. I don't know.
Rail cars.
I hear you. We have been working with a partner coalition group that did a public disclosure request to the Office of the Insurance Commissioner. So AARP didn't do it, but this other coalition group. And by far the #1 complaint around insurance is long-term care. And it's the exact same thing that you're mentioning, is that claims can go up artificially for no reason. And that's the big red flag we want to tell people who are trying to buy policies right now to opt out, is that these companies, there's no restriction on what they can do and what they can charge. And the rules just don't seem to apply to them. And, you know, right now, the insurance industry has painted themselves as the knight in shining armor that's coming in to save the day. But buyer beware, read those policies, find out if you have a rate lock and that you have a guaranteed premium that's not going to adjust and move up or change, or that they're not going to deny you claims. I read a story from part of that report, and I'll put the report in chat as well. So again, it's not AARP's report, it's this other coalition group. But a woman, 92 years old, blind, has had a heart attack, has diabetes, and the insurance company denied her claim for having an in-home assister to help her take a shower. And it's just like, this is ridiculous. And so that's why I feel like all of you, you know, you can be great advocates and great voices for just like buyer beware. You know, you might be buying this policy thinking that you're opting out of the WA Cares program because you want to avoid a tax, but this is something that's going to be there for you when you need it. Yes, it's not a huge amount of money, but it also adjusts with inflation. And so in the next 10 or 15 years, that 36.5 could easily be 47,000. So that is a meaningful benefit. And especially if you are aging in home and have an in-home care provider, that is something that would be paid for 12 to 18 months. So it's like buyer beware, understand these policies, understand, you know, pre-existing conditions. We also just heard somebody was denied because she was pregnant for a policy, and she wants us to fix that. And I'm like, I'm sorry, the rules are set by the insurance industry and nobody can do anything about it. And they've had this stronghold over consumers for decades. And that was why we created the WA Cares program, because the private market failed. The long-term care insurance policies became too expensive, and they were continually denying claims and forcing people to spend down into poverty and go on Medicaid. And that's just not okay. People should have the ability to retire and live their life with some minimal amount of care, with purpose and dignity, and not have to spend down their life's resources. Sorry, I get on my soapbox here.
Yeah. So Margaret, do you have a question or comment?
I do have a question. So I heard Andrea, thanks both of you for this presentation, and Reed too. This is really wonderful. So Andrea, I heard you say that if you're self-employed, which I am, then you can apply for this program through the ESD. And I saw that you gave the information. So is that something that I should do right away?
It starts on January 1st. They'll have that opened up on January 1st.
Oh, okay. And then also, is that when I also teach part-time, so I receive a W-2 from that, will that start automatically coming out of paychecks on January 1st unless you opt out?
Yes.
So you don't have to do anything. Right. You don't have to do anything to opt in.
That's right. It's automatic.
Except if you're self-employed, then you need to apply. Okay.
Yes, that's right.
But I can't apply before January 1st.
Correct.
Okay. Okay. All right. Thank you very much.
I have several things to say about this. Can you hear me? I have several things to say about this. Can you hear me now?
Yeah, we've heard you. Go ahead.
Okay. For 6 years, I owned a long-term care insurance agency. And first of all, I want to say that everybody who's presented so far has done a fabulous job. Kathleen, when you used the word ridiculous, that was a very, very good single word to describe the whole way that the long-term care agencies, carriers that is, run this business. The customer came last. The policy owner came last. So ARP and everybody else has a real big job to do to get this so that it's done correctly. Unfortunately, the policies said from the very beginning that we're not going to raise claims or premiums unless we do it for everybody in a class, which meant everybody of a specific age and sex. And it was black and white that it said it. But they also said that we've never done this till now. The problem was that when they went into this industry, the actuarial numbers were all wrong. And it proved to be a massive blunder for them all. And as a result, most of the policy owners like Lawrence and I can't read your name, but many people suffered. I am actually one who suffered in spite of buying and selling and knowing everything about it for certain reasons. When I was sick over the years, it gave the insurance company the opportunity to legally cancel my policy in spite of the $85,000 that I had already paid into premiums. So it's one big horror show. And we as a society really have an obligation to ourselves and those in the future people generations to solve this problem.
Yeah, Richard, I think that one of the things that your sad story illustrates is that there are some things that are best done by everybody in using government as a tool because it doesn't pencil out any other way. Highways and long-term care insurance may be a couple of those things.
This is an area where we all have an obligation to help each other.
So I want to let Andrea in here because she hasn't, we've been talking. I wonder if you have any perspective on what we've been saying here.
You know, I just appreciate hearing those stories. You know, I'm so sorry that you guys have gone through that. And, you know, from my perspective, we at DSHS had spent a few years on actuarial analysis related to the private long-term care insurance industry and whether or not it would have made sense for the state to invest more in a kind of a public-private model with the private long-term care insurance companies. And it penciled out the other way that, you know, this wasn't going to be a sustainable option to try to work with the private industry to make coverage affordable. And instead, you know, having this public option where people are paying in, that was really the key to being able to make this affordable for more folks across the board. So I think, you know, in addition to those personal stories, which I feel like are so important for people to understand, especially people who are buying policies now to avoid this program that is actually going to be very beneficial for them much later in life, but they're not to that point. So the more, I feel like the more that those stories can be shared, you know, it's going to help people think through what their options really are.
So I'm still working. So most of the dialogue that I've encountered here at work is how to get out of having to pay for this. And one of the things that is going around is they were saying something like in January, this may not all happen anyway. At least that's what people seem to be intimating. Is there any truth to that, or what might be the story behind that?
I can comment briefly on that, and then maybe Kathy, you could add to it. But it's written in the law that we're going to be starting to collect premiums in January 22. And so the legislature doesn't even convene until January. So I know there's been a lot of rumors about that, but in order for that to happen, they would have to be convening a special session of the legislature, which is very unlikely. So, we as agencies are ready to go, and starting in January, those premiums will start to be collected. It's in the law, it has to be done. So yeah, I don't know why or exactly the detail to how that message is being shared.
We just did, again, I mentioned some polling that we did here in Washington State. And even though there's a huge negative buzz going around on this, a majority of Washingtonians love this program. So once we start releasing out the data, the insurance industry has done a fine job, again, portraying themselves as a knight in shining armor, and that they're trying to poke holes into this program. But as soon as we share this data, it's majority support, and then it even goes up more as people understand the benefits of the WACARES program compared to long-term private insurance. So when you look at pre-existing conditions that you don't pay, beyond retirement, the favorability skyrockets up to almost over 70%. I'd like to just share another story. I have a friend, she makes a lot of money. She probably makes like $300,000 or $400,000 a year. It's one of those things you don't talk about as friends, but we've known each other for 20 plus years. And she was telling me, she's like, yeah, I have long-term care insurance, but I'm going to pay into the WACARES program too, because it's just the right thing to do. And she's like, I don't like seeing people in their 60s or 70s standing on street corners looking for money because they can't pay for their diabetes medication. And so we know, a big contributing factor to people financially struggling is the cost of prescription drugs. And, that forces them to make hard decisions about, food and housing and everything else. So I think, at least from her perspective, and she's also the kind of person that would go to a homeless, benefit, an auction, and drop $15,000. But she's like, I would rather pay into this program and feel that I'm contributing to helping somebody that might not be able to help themselves in the future. So it's just like, I'm like, can I clone you, Julie? Because that's exactly, this is what a social justice, social policy looks like.
One of the biggest elements to work on in the legislation as it currently stands is that situation with people who will retire, get 3 years of vesting, and then the vesting will expire. Are there other elements about this that we might want to look at as additions or improvements that we might want to talk with our legislators about?
So we have our oversight body, the LTSS Trust Commission. They're looking at options for the near retirees, and their role is to make recommendations to improve the program to the legislature. So besides the near retirees, they're also looking at people who would be required to pay in but don't live in the state of Washington. So in order for people to receive care through WACARES, you have to reside in Washington when you need it. And we have some people who live in Oregon, for example, and commute to work in Washington, so they'll be paying in. So they're looking at options for people who are in that situation. They're also looking at the people who have non-immigrant visas who might be here only temporarily because they're recruited by their employer, but then they're required to go back to their other country of origin. And then just in general portability, so having to reside in the state of Washington. A lot of people are thinking that they might be leaving the state, and if they do, they won't be able to take that benefit with them. It's only available for people when they reside in Washington. So they've spent the last couple of months looking at potential options there. And in our November meeting, we'll be talking a little bit more about what they'd like to recommend to the legislature.
I think there's a few things. One is potentially, and it's something that the insurance industry has actually been talking about. They want to have annual attestations for people with policy so that they're not just buying a policy and then dropping it. We don't know where that's going. It's not a policy area that ARP is looking at. We haven't made a decision on some of the things that Andrea mentioned about out of state or the near retirees. We think it's a really important issue. And then the portability. And I think the other thing around the portability that will be really interesting is that there are, I want to say about 5 states that are looking at basically replicating our program in their state, because the federal government will not, there's no way the federal government will do something like this for at least, 20 years, 10, 20 years. And that states, they can actually do this type of program. So the portability issue might potentially be addressed if we can get other states on board. So California is looking at this, Illinois, Utah, Massachusetts. And, if we get to a critical mass, then the portability issue in some ways solves itself, because you'd have similar types of systems. The problem that we have with portability is that this is not just a cash payment. We're not just handing out people, here's $36,500 for you to take to another state. That's not how this works. This works because we have an award-winning, incredible home and community-based services system within this state. And we've spent decades building it up. Andrea and her colleagues and her predecessors have done an outstanding job. AARP, the Commonwealth Fund, and the SCAN Foundation consistently name Washington State either #1 or #2 in the country for our home and community-based services. So that's in-home care for providing meals, transportation, case management, counseling, respite care, daycare, all these programs that we have in Washington State. Other states don't have this. They don't have the same kind of system. They rely on nursing homes and other residential care facilities for caring for people as they age. So it's less about in-home supports. So if we can get to a level of parity within those other states, then the portability will solve itself in some ways. But that's also something, another 10 years out. And one of the things I keep telling legislators, let's not, open up the trunk or open up the hood of the car thinking we're changing the oil and doing some little tweaks and fixes, and then having somebody take out the engine and this thing dies. So it's really concerning. We want to make sure that we're really smart, we're really firm on the policy, that if we do make any changes or advance any kinds of policies to quote improve, that we're not taking out the engine out of the car, inadvertently. I think the other thing too is I would encourage you to reach out to, Senator Rolfes and share your stories about what you've learned, from your generation and what you could tell the younger generation about the needs and about long-term care. I think that's really important. If you haven't already talked to her, I think she needs to hear from you. I also put in the chat, I put in a link to the long-term care options website, and also a link to the paper around the insurance industry. And Mr. Herzog, I would love to be able to follow up with you, and anyone else who wants to follow up and share their stories, please use my email that's also in the chat and send me an email.
I'm afraid that's all the time we have, but this has been very, very informative, Kathy and Andrea. Thank you so much for your time. When I post this, I will also post the links that Kathy put in the chat and the contact information that you gave Andrea.